this proposal was specifically targeted at developing a pragmatic framework for a seizure classification that makes sense when you're doing a clinical trial in which seizures are the primary outcome. And so there have been a number of iterations of seizure classifications by the ILAE over the past, decade. And some of the terms that have been used in clinical trials haven't always reflected what is meaningful in terms of tracking seizure outcomes. Some of the main things that we did in this proposal was simplifying the seizures that are trackable in a clinical trial and meaningful. So we really basically simplified things in terms of focal seizures between observable versus non-observable seizures, with the observable seizures being the ones that are worth tracking because they're reliable, there's good inter-reader reliability. And we also looked at generalized epilepsies and the types of seizures that are tracked in these trials, and specifically because there's been a lot of interest in Lennox-Gastaut syndrome, Dravet syndrome in the past few years, new therapeutics coming down the pipeline for those disorders. And we sort of modified the existing classification to make it a lot more simple, got rid of the term drop seizures, which means a lot of different things to different people and isn't really reliable in terms of tracking in a clinical trial. And we introduced a modifier likely to lead to fall, which is really what you're trying to do when you're classifying a drop seizure. And we sort of talk a little bit about what makes sense in the future for some of these patients who may not have countable seizures, so use of surrogate endpoints like EEG to be able to track outcome in patients who have uncountable absence seizures or myoclonic seizures, for example. There's now trials that are using RNS, so responsive neurostimulation, long episodes as a surrogate endpoint. So a lot of exciting things that are happening now in modifying our approach to, tracking the effect of a novel anti-seizure or even anti-epileptic medication on the epilepsy.